Good day, everyone. I am Palakit Tambilawan, and I am tasked to present to you our learning outcomes for this topic sample preparation and handling. At the end of this discussion, you should be able to first know what pre examination errors can occur with a sample and how these errors can affect a patient's result. Second, explain how exercise and stress can affect a laboratory results. Third, list the tests that require chilling or warming and explain why these steps are necessary. Fourth, describe situations that would result in recollection or rejection of a sample. And lastly, describe the methods of transporting samples. Without proper sample preparation and handling, samples may give invalid results. And if you have recalled our previous topics, we already encountered the term pre examination. And we are also able to discuss its importance in obtaining samples. So we have here the list of our pre-examination variables according to the book, and we will discuss it one by one. So again, pre-examination errors are errors that occur prior to testing comprise 46 to 56% of all errors encountered for laboratory samples. And pre-examination errors are also called the pre-analytical errors, which occur before the analytical portion of the testing. The first and crucial pre-examination variable is the improper patient identification. And improper patient identification may give the patients wrong results that may cause harm to our patients. And as a phlebotomist, we need to identify and verify the patient's identification before the collection. And we must also ensure that we have labeled all the samples collected. And the second one is the tourniquet. So tourniquets are under a phlebotomist control that can create a change in the patient's test results. And tourniquets increases the intravascular blood pressure that pushes the small molecules and fluids from capillaries into the surrounding tissues. And tourniquets should be on the arm no longer than 1 minute, because if tourniquets are in the arm more than 1 minute, this may result or this results in hemoconcentration, which affects the reliability of our results. And also the inability to circulate lowers the pH, and change in pH causes an increase in calcium and magnesium.
So hi, my name is Princess May Lagamon and today we're going to talk about exercise and posture. So too much exercise can affect the result of the testing. A patient's cell permeability will change if he or she just completed a vigorous exercise. So this can cause concentration of CK, AST, LDH, bilirubin, creatinine, and uric acid. Changes due to exercise may cause white blood cells to increase and hemoglobin to decrease. So changes due to posture may cause calcium and blood pressure to increase while the blood volume will decrease. The changes from supine to sitting position cause clinically significant increase in the hemoglobin, hematocrit, and red blood cell count. So stress also have the similar effect. White blood cells can increase as much as 20,000 as a result of exercise or stress. Our neutrophils and glucose level will also show a marked increase due to exercise and posture, also stress. So let's move on to fasting and timed samples. So before collecting any fasting samples, the phlebotomist should always determine if the patient is fasting. and the patient must have no intake for 8 to 12 hours. Lying about fasting is discouraged because this will lead to misdiagnosis. Fasting samples have no specific time for collection, but other tests may require that the sample should be collected at a specific time because of medication or diurnal rhythm. So there are two time blood specimen. One is for a single blood specimen ordered to be drawn at a specific time. The other one is for a test that may require multiple blood specimens to be collected at a several specific times. So it is important that the individual has not had anything to eat or drink other than water for 8 to 12 hours because a fasting blood glucose test. So a person will typically fast overnight and do the test early in the morning. Fasting helps ensure the blood test records are accurate measure of blood sugar levels. So now let's move on to evacuated tubes. So pre-examination errors can happen from an incorrect volume of blood in the tube. It's best to provide a properly filled tubes to avoid an error in results or a recall of the patient. So tubes must be 75% of the stated volume. In case of underfilled tubes, the phlebotomist must draw another tube to obtain the proper amount. However, if the patient is unavailable for recollection, the phlebotomist should send a partially filled tubes to the laboratory. So the laboratory can determine if the samples can be combined and if they can proceed with the testing.
In continuation to that, I am Hazel K. Arroy, the next reporter of this group. Problem with syringe collection arises when syringes are used to collect blood samples. The CLSI guidelines discourage the use of syringe because some have limited venous access that may be life-threatening to a patient. A patient with veins that may collapse or become injured from excessive syringe pressure may require an alternate method of venous sampling or the use of a smaller syringe. Example for that is the butterfly collection or the scalp vein set. This system is commonly used when draws are difficult, such as in older adults, children, and in infants. It is also used when obtaining blood samples for tests at blood bank on blood donors. The next one is evacuated tube system. It is the most commonly used means of collecting specimens. It allows blood to pass directly from the vein to the evacuated tube. Syringe collection. Syringe collection is better used when veins are small and fragile. If syringe collection is used, there is an increase in hemolysis and clotting samples collected. Study shows that 19% of samples drawn from syringe are considered hemolysis and 3% for evacuated tube system. Syringe collected samples EDTA are clotted compared to the evacuated tube system. Cleaning the venipuncture site. Sites of venipuncture are usually cleansed with alcohol. Povidone iodine, or also known as betadine, has been used widely as a skin disinfectant performing blood culture. Other than that, do not use povidone iodine in cleansing the wound, for it can increase the potassium, phosphorus, and uric acid. Use non-alcohol cleaner in cleansing venipuncture site for blood alcohol testing. As what we have learned in the previous discussion, there is a specific order when filling evacuated tubes, from a syringe into an evacuated system. If you are asked to fill a lot of tube, there is a recommended order of draw. The first one is blood culture bottle or yellow stoppered blood culture tubes. The second one is the coagulation tubes or the light blue stopper. Third one is serum tubes with or without clot activator or separating gel. Fourth one is heparin tubes with or without gel plasma separator, or also known as the green stopper. Fifth one is ethylene diamine tetraacetic acid, or EDTA tubes, or the lavender stopper. Sixth one is the oxalate or the fluoride glycolytic inhibitor tubes, or the gray stopper. Or we can remember the mnemonics: stop light red, green light go. The correct order of draw prevents the anticoagulant from one tube from contaminating the next tube. EDTA and heparin can elevate prothrombin and activated partial thromboplastin time. Test result if drawn before the citrate tube. EDTA contamination can give high potassium results if the tube is tested before EDTA requires potassium result. The EDTA that in the tube is either dipotassium EDTA or tripotassium EDTA. The reason heparin tube must be drawn before the EDTA tube.
So good day, I am Daryl Dave Parpan, and at this moment we will be having the continuation of the previous topic, and we will be discussing about the chilling of the samples. So there are certain samples that require chilling immediately after the collection. So the sample should be placed in a mixture of ice and water as soon as it is withdrawn from the evacuated tube holder. Some tests requires pre-chilling the empty evacuated tube before drawing the blood, and any delay on icing the sample alters the test results. So the longer the delay, the greater the change in test results. So in cases like transporting blood from one place to another, it is very important to transport blood chilled or frozen, and this keeps the risk of bacterial growth low. But remember, all samples cannot be chilled. So the following are the examples of common tests that requires chilling of the specimen. First is the ammonia, second is the acid phosphatase, third is the catecholamines, fourth is the lactic acid, and the last one is the pH or the blood gases. So next is the warming of the samples. So there are some tests that need to be kept warm. So the test must be maintained at the body temperature of 37 degrees Celsius. And the best method of maintaining this temperature is to wrap the sample in a heel warmer or to use a plastic block that is maintained at body temperature before taking it to the patient. And these blocks have holes drilled in them to accept different sizes of tubes. It is very essential to warm it to an appropriate temperature, not only to prevent hypothermia, but also to prevent hemolysis or the breakdown of the blood cells. So in some cases, if the transfusion is done too quickly without warming the blood, the colder blood can initiate a state of hypothermia within the patient. So the following are the tests that must be maintained at 37 degrees Celsius. First is the cold agglutinins, and the last one is the cryoglobulins. So as you can see in the figure 1, it is the ice bath chilling of the sample, wherein the sample was soaked in an ice. And for the figure 2, it is the maintaining a sample at the 37 degrees Celsius, wherein the sample was wrapped in a plastic block. So for the last pre-examination variable, we have the exposure to sunlight. So light can be detrimental to some samples. Detrimental means to tending to cause harm. And collecting bilirubin samples in a capillary collection tubes exposes the samples to light more directly, and therefore they should be um, collected in an amber tube. So the various other tests must be protected from light. Examples are the vitamin C, E, and K. And the most effective method to protect the sample from light is to wrap it in a aluminum foil. So a specific wavelength of light can break down bilirubin into a form that the body can get rid of through the urine and stools. Room light or sunlight can metabolize the bilirubin in the specimen to a different compound. So for the figure 3, it is the protecting samples from sunlight with aluminum foil or an amber tube. So here in this image, the sample was wrapped in an aluminum foil to avoid direct or indirect exposure to sunlight.
So hi, I am Daniel Emon Leon and I am going to discuss the criteria for recollection or rejection of a sample. The goal of the phlebotomist is to provide acceptable samples for laboratory testing as required by the physician. Certain general criteria must be followed for a sample to be acceptable, and if the criteria are not followed, the sample must be rejected and recollected. So, these are the following general criteria. First is each sample must have its own label attached to the sample's primary container. Each sample must have on the label the name of the test to be performed. Labels must have the patient's complete name and hospital number or unique identifier. The sample must be collected within the time limits requested. Samples in syringes must have needles removed and the syringe capped before transport. Urine samples must have the label on the container and not on the lid. The appropriate anticoagulant must be at least 75% full, and all coagulation tubes must be at least 90% full. Next is tubes may not be used beyond the expiration date. Certain samples may not be exposed to light. Delays in centrifuging or processing a sample will invalidate the results. Anticoagulated blood samples must be free of clots. Certain tests require samples to be free of hemolysis and lipemia. Blood samples drawn above an intravenous injection site are unacceptable, and the sample must be recollected if the results are not consistent with previous results on the patient. So, this list is not all-inclusive. The type of sample acceptable and the volume required are determined by the procedure ordered. There are exceptions to volume requirements where the laboratory can work with small sample sizes. Recollection is most often done to recheck results on a patient, and when the results of one sample change significantly from a previous sample, either retesting the sample or recollecting the sample rechecks the test. This reconfirms that the correct sample was drawn from the correct patient and that the patient's test results did change significantly.
Hi, I am Richard Cyril J. Abelgas. For my discussion, I'm going to discuss the preparation and transportation. So transportation, so once the sample has been collected, they must be transported to a laboratory within the facility or to another laboratory, possibly 100 miles away. So the phlebotomist or the transporter or a pneumatic tube system usually does the transportation within the facility. So there is a little time loss and minimal chance of breakage if the sample is delivered within the facility. So the primary container is the container in which the sample was collected. So when a sample is transported, this primary container must be placed in another container, which is the secondary container, so that any leakage or breakage of the primary container is contained. So the increased use of plastic tubes has reduced the incidence of breakage, but there is still a possibility of the cup coming off the tube. So a plastic self-sealing bag is sufficient as a secondary container for most sample only. So a single sample or multi-sample from one patient can be placed in a bag and then the bag sealed shut. So, and samples from different patients should not be placed in the same bag because there might be a interchange of sample. So all label must be attached to the sample tubes before they are placed in the bag. For a large number of samples, the sample can be placed in a rack to avoid spillage or breakage, and the entire rack is placed in a bag or a leak-proof box, or pwede po ice box. So, standard camping coolers come in a various size and are excellent for this purpose, as I said kaganiha. So whatever the secondary container is used, the biohazard emblem must be attached to it so we can identify that if it's a hazardous sample. So in pneumatic tube system, that transport sample are more traumatic than hand carrying sample. Uh, but there is a slight advantage and disadvantage of pneumatic tube system. The advantage of pneumatic tube system is that uh, it is much more fast to deliver, but they are more prone to uh, breakage or hemolyzed sample if blood ang ginakolekta. So, in order to prevent the trauma to the sample, the bag sample is placed into a padded container to maintain its integrity. So, as we can see in this illustration, that is the uh, bag niya. So, most laboratories have local couriers who pick the samples, and these couriers have been trained in how to handle bloodborne pathogens and have special container to transport sample to the laboratory. So, the self-sealing bags for these specimens have two compartments. One is for the sample and other compartment is for requisition. Requisition. The outside of the shipping container must have always biohazard emblem and wording that the container holds an etiologic agent or infectious disease or infectious substance. So some transportation service do not handle etiologic agents. So check with the transportation service before shipping any sample. So there are severe fines for shipping etiologic agents without proper identification and packaging. So the Federal Aviation Administration and other government agencies try to regulate the shipments of this etiological agent so that anyone packaging and shipping this agent must have a special documented training and regulation. As for the Center for Disease Control and Prevention, they indicate that these specimens shipments in the United States and internationally are regulated under the Hazardous Materials Regulation or Dangerous Goods Regulation. So the clinical specimens required packaging that meets the Department of Transportation. So the Transportation Hazardous Material Regulation and International Air Transport Association of Dangerous Goods Regulation. The International Air Transport Association or IATA Dangerous Goods Regulation classify these infectious substance into two categories, the biological substance category A and biological substance category B. So the biological substance A is an infection substance which in a form that when exposure to it occurs incapable causing permanent disability or life-threatening or fatal disease in otherwise healthy humans or animals. So the proper shipping names for this substance are UN 2814, which is the infectious substance affecting human, and UN 2900, or infectious substance affecting animals. In biological substance category B, an infectious substance in which does not meet the criteria for inclusion in category A. Infectious substance in category B must be assigned to UN 3373, or the category B infectious substance is the classification of clinical specimen requested in support of a VSP acute gastroenteritis outbreak investigation. So the integrity of the sample must be maintained during the shipment. So extreme variation in temperature, we must avoid it. So that if the sample gets too hot or freeze, it will rupture the red blood. It will hemolyze the red blood cell. So this is especially significant if the sample is a whole blood sample. So a CBC sample in a EDTA sample or tube will be totally unacceptable after extreme temperature variation. The serum or plasma sample might be more tolerant because the red blood cells have been removed from the sample, but the test result will be altered with the temperature changes. So the maximum time the sample takes to arrive at the destination must be determined, and then the appropriate amount of dry ice or insulation must be added to protect the sample. So all serum and plasma should be removed from the cell before transporting. And temperature extremes are considered when sending sample in long distance, but we often ignored for short distances. So this is often the case when a phlebotomist is collecting sample at the different nursing homes. A sample is collected and left in a car while the phlebotomist goes to another nursing home to on a list of stops in the short time it takes to go to the nursing home and draw a sample. So the temperature in the car can change dramatically, and the sample can be overheated or frozen when the phlebotomist returns, so any sample that is left in the car should be placed in a cooler to prevent extremes in temperature. Medical legal transport. So transportation of samples for blood alcohol testing, paternity testing, or legal toxicology tests must be given special consideration because this blood sample for alcohol are collected both for medical purposes to help treat the patient for any legal cases. So the medical reasons for alcohol testing are to check if the patient is unconscious because of intoxication or there is a medical condition. So at most states that collect these sample for legal alcohol testing or drunk driving cases will have a special draw kit in emergency departments of hospital. So this kit has special collection tubes and chain of custody forms, and samples are sent to the state police laboratory and not in the hospital laboratory. So this keeps the hospital laboratory from getting involved in legal cases related to blood drawn. Usually, emergency department physician or nurse will be licensed by the state to collect the sample and not involve the laboratory. So in most state, the laboratory records or sample can be sub-open even though they have not been involved with subpoenaed pala, even though they are not been involved in the chain of custody. And for most paternity testing, there must be a documentation that sample was collected from the correct individual. And taking picture of a child and alleged mother or alleged father in such circumstances, as the medical legal requirements attempt to ensure that the sample was properly processed. So most of chain of custody samples are collected for drug testing. So urine is the most common sample to be collected, but we also process saliva and hair are gaining acceptance. So the first patient must have given consent for the test to be collected. So the person collecting the sample must have documented training on collection of chain of custody sample. So the sample must also be properly identified and time of collection must be noted always. So on all medical legal samples, a chain of custody forms must be completed and must accompany the sample. As we can see in this figure 10.10, this will certify that the sample was obtained from individual named as the source of the sample. So all individuals who had possession of the sample before analysis are listed, and the technologist performing the analysis is named. During this process, the sample must be secured to prevent tampering and must not be exposed to extreme that would alter the results. So that is for my topic. Thank you.